So thank you in advance for your time today. My name is Shanae Armstrong. I am the Senior Reimbursement Manager here at Neuronetics. I am joined on the line by Mr. Hilton Jackson, our Reimbursement Manager for the Southeast region. Hilton and I will be discussing some of the tips for navigating the reimbursement landscape. Let's start off talking about the truth about TMS. I'm going to provide some facts or some myths about TMS. Please use the chat through the GoToWebinar and enter fact or myth after each question. Fact or myth, NeuroStar Advanced Therapy is not covered by insurance. I'm hoping that that's an easy one. In fact, NeuroStar Advanced Therapy is widely reimbursed by commercial and governmental health plans, including Medicare and TRICARE. As a matter of fact, all of the Medicare plans and all of the major players, especially the Blues, actually have a coverage policy for TMS. Next question. Fact or myth? Maintenance is covered by Medicare. Myth. In fact, there are currently no Medicare policies that cover maintenance. However, reintroduction of TMS is covered for patients that have a history of TMS in a previous depressive episode, and they've shown improvement by 50% on the rating scale. Last question. Fact or myth? NeuroStar Advanced Therapy can be used in the treatment of depression after one antidepressant medication has failed, but not multiple. That's actually a myth. In fact, NeuroStar Advanced Therapy may be an appropriate depression treatment for adult patients who are attempted one or multiple depression medications yet are still symptomatic. So when we talk a little bit about depression, there's an estimated of 16.1 million people that suffer from depression. Half of those that get treated, and out of the half that get treated, 4.5 million people end up with side effects or have a poor response to their treatment. So when we add the 4.5 million people who had a poor response to the 9 million people that didn't get treated, that's about 13 million people in the patient population. Now, whereas there are many contributing factors to this disease, what is most common in all 13 million is that the people did not get the treatment that they needed. We're going to go over a couple things over the next hour about navigating the reimbursement landscape. Now, we do realize that navigating the reimbursement landscape can be a challenge. Therefore, we put together this webinar to address some of the common issues that arise and answer some of the pressing questions. Now, there's no denying health policy, insurance benefits, coverage policies, coding, billing, and coverage. This can be complex. So our job over the next hour is to provide you with some tips about reimbursement and to empower you to help your patients get access for this therapy. So now let's take a look at the disclaimer. So the information contained in this presentation is for educational purposes only. The presentation represents no statement, no promise, no guarantee by Neuronetics concerning levels of reimbursement, payment, or even charge. All of the coding, billing, and coverage guidelines vary according to the payer's contract, according to the patient's plan, and according to what's medically necessary for the patient. We do encourage providers to bill to this highest level of specificity. Let's talk a little bit about the indication for NeuroStar. As you know, NeuroStar Advanced Therapy is indicated for the treatment of major depressive disorder in adult patients who have failed to receive satisfactory improvement from prior antidepressant medication in the current episode. With that being said, NeuroStar Advanced Therapy should be considered as an appropriate choice early in the course of the patient's treatment of depression for patients who have not benefited from the first-line treatment. And the contraindications. So NeuroStar Advanced Therapy is contraindicated in patients with non-removable conducive metal in or near the head. Please refer to www.neurostar.com for complete product and safety information. Now let's turn our attention to the agenda. So now that we know the indication and the contraindication for NeuroStar Advanced Therapy, what does that all really mean if the patient cannot access the care that's needed due to the reimbursement barriers? As I mentioned early on, we know that the reimbursement process is complex. We will break up this webinar into two different sections. I'm going to go through some of the reimbursement support services. I'll talk a little bit about the importance of doing a benefit investigation. Then I'll switch gears and talk a little bit about the prior authorization process and prior authorization best practices. I'll then hand it over to Hilton, and he's going to go through access to policies, appeal tips, and real-world news. As I mentioned, our intent is to leave time at the end to be able to review the questions. So now that we've taken care of some of the logistics, let's begin. As a provider, you need to make sure that you're able to do what you do best, and that is identifying patients and treating patients. With that being said, we need to make sure that you're able to get paid appropriately for the work that you're doing. Now, we're excited to be your NeuroStar Advanced partner. Other TMS manufacturers have not dedicated the resources and do not provide the significant support and commitment to your practice success. I want to encourage you to take advantage of our full reimbursement support services and our commitment to you to being able to help you be successful from day one and beyond. We're not just another card in the Rolodex. We want to be able to help you throughout the entire reimbursement process. Okay, so if there are questions that come up, please feel free to give us a call. As you may know, we actually have three components of reimbursement support: our provider-facing support, our payer-facing support, and our NeuroStar reimbursement support hotline. Our provider-facing team, or better known as our reimbursement managers, are dedicated to partnering with you to remove all reimbursement barriers. Our reimbursement manager team collaborates on educating providers regarding coverage policies, including treatment guidelines, the insurance process, claim submissions, the appeals process, coding, and billing. Our team really supports the process from beginning to end, working with providers for ongoing training to keep up with all the changes in the insurance world. And if you've been in this industry long enough, you know there are always changes. Our payer-facing support team has led the efforts in broadening patient coverage, and they are committed to working with our providers to improve patient access at the national and the local level. And lastly, our NeuroStar reimbursement support hotline. Our NeuroStar reimbursement support hotline has the most experienced specialists in the TMS industry with over 26,000 completed benefit investigations. Our hotline conducts the benefit verifications and determines coverage for patients and reports that information directly back to you at the office. After the benefit verification and benefit investigation is completed, our hotline will provide a comprehensive summary of benefits with next steps for the patient to access the therapy. Included in the comprehensive summary of benefits, our hotline is going to provide very specific details on what is the cost share for the patient, what's the patient's policy effective date, is TMS covered specifically for this particular patient, and if so, what are the next steps to access the therapy? Now, as you may know, there are variations of coverage based on a patient's plan. You may have two patients with the same payer but completely different coverage. That's one of the reasons why it's imperative to do a benefit verification for each and every patient. So the actual question at hand is, why is it important to do a benefit investigation? So for starters, benefits vary based on a plan. Not every insurance plan is the same. It all depends on the type of insurance, the type of policy, the plan the patient buys, or if the patient has to go through the employer or health group. There are several plans up under a specific insurance payer, and all of them may have completely different benefits with completely different coverage. Next, it's important to do a benefit verification because it sets expectations on patients' cost share. I think we can all agree that we want to be able to put our patients first. I guarantee either yourself or someone you know has gone into a doctor's office or a hospital visit or had a procedure done and 30 days later received an unexpected bill in the mail with a patient responsibility. Whether it's going to the dentist and getting a bill or going to your primary care physician and getting an explanation of benefits, no one wants to be able to get a bill for services that were rendered without potentially knowing the cost share at the beginning. We want to be able to put our patients first, and doing that ensures that we're able to do a benefit verification so they know very specifically what their cost share is associated before they actually start the treatment for TMS. Along the lines of putting the patient first, when we're really verifying benefits, we're checking to see if the patient has coverage for the specific service. So in this case, you're verifying that TMS will actually be covered for the patient. A benefit investigation will also tell you how much the insurance will pay. But most importantly, it determines what the patient responsibility will be. Does this patient have a $20 copay? Or does this patient have a 20% coinsurance? A benefit investigation sets the expectation on the cost share for the patient. Lastly, the benefit investigation affects your bottom line. You want to be able to put patients first, but you also want to make sure that you're being cost effective. Making sure that you get reimbursed is absolutely part of being cost effective. Not verifying benefits prior to rendering the service can result in non-payment, which affects the bottom line. Let's be honest, it's a pretty costly mistake if you're not doing the benefit verification prior to the patient starting the treatment. Just because a patient is active, it doesn't mean that an insurance will actually pay. In order for insurance to pay, you have to ensure that not only is the patient active, but the patient has the benefit and it's also a covered service. Don't just assume a service is going to be covered because it was covered for another patient or has been covered in the past. Whether you're verifying benefits using our NeuroStar reimbursement support hotline, if you're verifying benefits online with the payer or over the phone, verifying benefits is essential to the success of TMS and keeping patients first. So now that we talked a little bit about why benefit investigations are important, it is important to make sure that we're following the guidance provided by the payer to determine next steps for the patient to access the therapy. Most often, that really means doing a prior authorization. With that being said, let's switch topics and talk a little bit about the prior authorization processes. As you may know, most insurance plans, with the exception of a few, specifically the traditional Medicare, most insurance plans require a prior authorization for TMS. So now that we've done a benefit investigation, what's next? What do we do next now that that benefit investigation has been done? Contrary to what some believe, the prior authorization is really used by some health insurance plans to help to determine if a procedure or service is covered. The process is intended to act as a safety and a cost-saving measure, although it's really received a lot of criticism in the past. Many physicians and office managers and TMS coordinators would likely believe that the prior authorization process is quite time-consuming and costly. So let's turn our attention to what are some of the best practices for a prior authorization. Is a prior authorization approved? Is the prior authorization denied? Did the prior authorization go to peer-to-peer and therefore had no decision? There are really some common things in determining next steps for the patient to access the therapy. Now, no one likes to be able to backtrack. And I say that to say it's imperative that you try to do the prior authorization prior to the patient starting the treatment. Let's think about the prior authorization from a more logical perspective. Let's create some similarities with the prior authorization process in ordering a burger from a fast food chain. For the purposes of this example, let's really simplify the prior authorization process. So, when you are placing an order for a burger at a fast food chain of your liking, you want to ensure that you give your order to the fast food vendor exactly as you want it. You want to make sure that they customize your burger based on what you see in the picture, using it as a guide. You'll read the fine print underneath the burger picture to see everything that's included in burger number 4, and you want to be very specific with what you're ordering on the front end, using the picture here again as a guide. You articulate what you want on the burger, and you eliminate what's not needed on the front end to ensure your burger is 100% accurate when it's actually told to that particular food chain vendor. You're truly taking your time to ensure accuracy on the front end, placing importance on the order and what you're wanting to ensure that you're giving that particular vendor exactly what you want. So let's just take a different view of this. Let's talk about TMS specifically and how this is comparable to TMS. The payers actually provide you with a guide when they have a medical policy for TMS. So you have the payer's policy as a guide. When you're submitting the prior authorization, you want to be able to provide the information exactly as it's requested from the payer, showing how this is medically necessary based on your clinical assessment. In the prior authorization submission, you want to be able to speak to very specifically why this patient needs TMS. You want to basically be able to articulate exactly what needs to be assessed to determine how this patient meets the criteria based on your guide. Now, I know I took some liberties and really simplified this particular process, but the takeaway from this is making sure that when you're submitting for your prior authorization, you're providing the payer with exactly what's needed to be able to show how this patient meets the medical criteria. And the way that you do that is utilizing the medical policy as your guide. So first, let's take a look and determine kind of where we go from now as it relates to the best practices with an authorization. First, you need to determine whether or not this particular patient's plan has a coverage policy of TMS. During this call today, Hilton's going to walk you through exactly where you need to go to determine if there's a coverage policy for TMS. If there is a coverage policy for TMS, please make sure that you're reviewing the medical coverage criteria by the payer. Before you submit the prior authorization, you want to be able to prove and show exactly how the patient meets the medical criteria based on what the policy is requesting. Once you've been able to prove and show, the next step is to actually submit the prior authorization. If there's a specific form that needs to be completed, have the medical criteria beside you as you're completing the form. Make sure that you're leaving no blanks on that particular form from a prior authorization perspective. If there's something or a question on that form that doesn't necessarily apply specifically for that patient, don't leave it blank, put NA. If you actually need to call in the prior authorization, just make sure you have the medical necessity details available before the call. Does this particular patient have the medication trials requested? Does the patient have psychotherapy? Is the patient a candidate for ECT, but TMS is less invasive? These are the questions that you should be available and ready to answer in the event you're asked on the prior authorization call. In short, just making sure that you keep the medical criteria in mind. The payer doesn't want to have to look for the details to see how this patient meets the criteria. We want to ensure that when you're submitting the prior authorization details or when you're calling in the prior authorization details, you're ensuring the information is clear, clean, and concise. And let's be honest, whether it's TMS or any services you're providing, documentation is the key. If it's not documented, it didn't happen. Okay? Next up, once that prior authorization has been submitted and you have your information documented, making sure that you're utilizing a log to be able to track your cases. If you don't have a log, feel free to reach out to our reimbursement managers and we'll be happy to provide you with a template log as well. The main takeaway from this particular slide is making sure that you absolutely always request a prior authorization number. That prior authorization number will be put on the claims once they're submitted for this particular patient's plan. So going back to our fast food example, there's nothing worse than placing an order for your fast food burger and forgetting to add cheese to your request, as cheese is your favorite. And now you're having to go back in and ask that they remake your burger because you did not accurately report what was needed on the front end for you. So in other words, there's nothing worse than submitting the prior authorization and knowing that you did not submit all the information to be able to show how it's medically necessary, and now having to wait for your burger, or in this case, a prior authorization, to get turned around, which thus is going to cause potential delays. So the bottom line in reference to that is just making sure that you do your legwork on the front end to prevent waiting and to prevent delays. We do have some resources to be able to kind of walk you through best practices for prior authorizations and appeals. We recommend what we call the 3 R's of the prior authorization success: review, response, and result. 3 R's. So the first R, review. So review the details that you're sending over to the payer to ensure it's accurate and in line with what's being requested from the payer. Only send the payer what they're asking for. Now, I do know that some patients have 80 pages of information in clinicals. There is no need to send 80 pages to an insurance plan. Instead, frankly speaking, most payers will likely not even read it. But instead, what you're going to need to submit is very specifically what's being requested. Next R is response. Once you submit your prior authorization information, anticipate a response. If you don't hear anything back, let's say within 3 days from a prior authorization perspective, it's likely a good time to be able to follow up to check on the status of that prior authorization. Next and final R is result. Make sure you get a reply, or in this case, a result. And realistically, you really want to be able to get an approval, okay? So before you're able to move forward, make sure you get a reply or some type of result from that particular insurance plan. So now we've talked a little bit about the prior authorization best practices. I'm going to hand it over to Hilton, and he's going to talk a little bit about accessing the policy.
Thank you, Shanae. So what we have here presented before you is the NeuroStar website. Simply by entering in www.neurostar.com, it takes you directly to this webpage that's displayed in front of you, and identifying whether or not your insurance plan has a coverage policy is as simply as getting to this webpage. As you see circled at the top right corner of the page, there's the insurance tab, if you will, that's circled in red. Essentially, what that is going to do is start the process of walking you through the steps that's going to take you directly to your insurance plan. There are multiple ways via this website that will allow you to get to your insurance plan, but we feel like this is probably the easiest path. So what you're seeing here is just a different format of the NeuroStar website, and the page that Shanae is now on, that's fine, you're fine. The page that we're on actually shows you what this steps looks like. So essentially, as you click on the insurance tab two pages prior, it's going to ultimately take you here where you have the 2 drop-down menus. Those 2 drop-down menus will determine whether you will be able to identify your coverage policy. So you have the ability or the capability of looking at the payer's medical policy and criteria. We've included links to take you directly from the Neuronetics website directly to that payer's website, and I'll walk you through that process. So for the sake of our conversation today, we selected on the left drop-down menu commercial, right? And so what will be determined in the right drop-down menu is based on what we select on the left. So for the sake of our conversation, we select commercial, and that first policy that appears in that drop-down menu is Aetna. From there, we will just simply click search. a pop-up box will appear letting you know that you are leaving the Neuronetics website. And as indicated on this slide, it's going to take you directly to an example of Aetna's coverage policy, right? It's suggested that as you guys are reaching out to payers to obtain authorization, either you have this printed or you have this screen handy, because as you saw, it only took a few simple steps in order to identify Aetna's coverage policy. So as you're talking to that customer service rep with the insurance plan, you can make sure that you are viewing their national coverage policy, and that insurance representative is quoting you benefits or granting you an authorization based on this exact policy. If in fact that customer service representative is unable to see this policy number 0469, then I suggest that you simply ask them to speak with another representative, merely because they are unable to see exactly what you're seeing, which is their national coverage policy. Now, not all coverage policies will be available on the Neuronetics website. So for those generic insurance plans, please contact the plan directly to identify if they have a behavioral health policy for transcranial magnetic stimulation, or TMS. So we're going to talk about denials. And denials do not mean that it's not going to happen. And we're going to talk about some tips that will allow us to work with you, as well as working with the insurance plan, to push back regarding those denials. So a medical policy typically consists of an LCD in the event that we're speaking to Medicare is written to govern whether a defined procedure or policy is a covered benefit. You know, medical policies do not guarantee coverage. You know, there's a discrepancy between the medical policy and the member's benefit plan or summary plan description. The benefit plan, summary plan description, or contract essentially will govern how that policy is going to be identified or understood with regards to that patient's benefits. The common requirements for a medical policy is the use of a FDA cleared device, primary diagnosis of severe major depressive disorder, adults greater than the age or equal to the age of 22. The physician is often a psychiatrist that needs to prescribe the TMS treatment, failure of 4 medication trials, a course of psychotherapy, and ECT not being a viable option. In addition, most policies have contraindications and exclusions such as seizure disorder, other psychiatric diagnoses, certain neurological conditions, and recent substance abuse. I cannot begin to present the variation that exists from one payer to the next, but the devil is often buried in the details, which you are able to access now by going directly through the NeuroStar website. So just trust me when I advise you, always refer to the payer's medical policy for specifics. Where most fail when reviewing the medical policy, it's regarding the words and or. And means that it's all inclusive, or simply means that you have options. So with regards to denials, we should think about, why was the authorization request denied initially? Did we not have supporting documentation to meet medical necessity? Is major depressive disorder primary, or was there a different diagnosis primary in the information that we submitted to the payer? We want to make sure that we're adding value to our rebuttals, and we want the payer to know why the patient wasn't able to tolerate the medication trial. And based on the patient not being able to tolerate that medication trial, what steps did we take afterwards? Sometimes showing improving the case, you may have to cut and paste from the payer's coverage policy and include that in your specific details of your rebuttal to the actual denial in which you received. There may be occasions where the appeal needs to be elevated to the next level simply because you're speaking to a person or a reviewer of your appeal doesn't fully understand the requirements or the criteria specifically to TMS. Oftentimes it's equally as beneficial to get the patient involved. Having the patient go back to their insurance plan and push back to say that they're trying to access a therapy and are being denied for all intents and purposes, that they feel like, based on conversations with the actual provider, reviewing the actual coverage policy, they feel like they meet that criteria. So getting patients involved has oftentimes proven to be a positive result, if you will. What happens when a patient doesn't get treated? Oftentimes that can lead to hospitalizations, more medications, ultimately means more cost expenditures for the payer itself. So we're trying to present that here's a less invasive option for the patient, not necessarily continuing to prescribe meds, but an option for the patient to get back to life as they know it. Do you want to get paid, or would you simply like to get caught up in the circle of denials? Getting paid essentially is a process of simply filing a clean claim. It sounds complex, but it's really not complicated. The idea is making sure we follow the criteria that's established by the payer, making sure a patient has met that criteria, making sure that we have submitted all of the information necessary to conduct a benefit investigation, reviewing the results of that investigation, making sure the patient understands their benefits, submitting a request for a prior authorization, making sure that that prior authorization is appended to that claim, each claim that is submitted to the payer, and the expectation is that the payer is going to pay. We do know that payers will misbehave. However, we have followed all of the guidelines and the processes and the procedures in that we feel like the patient has met that criteria. So as we have gone through this process, wanting to get paid, the answer is yes. Filing a clean claim is usually understood. We just want to make sure that we emphasize what those steps are in order to ensure that we are filing clean claims, because the expectation is we want providers only focused on treating patients and not worrying about reimbursement. That's why we're partnering with you guys. So as we've talked about how to access NeuroStar policies and talked about some of the steps that we would take in order to push back regarding denials, let's talk about real world news. Extra, read all about it. These are some of the typical questions that we get from newer providers with regards to TMS treatment. First question, are maintenance and booster treatments covered? As Shanae mentioned early in her presentation, maintenance and boosters are not covered. Second question, can I bill an office visit and TMS on the same day? The answer to the question is, according to Medicare guidelines, yes, a patient can be treated for an E&M visit on the same day as a TMS treatment. However, this is where you would append your 25 modifier to your E&M code. However, 25 modifier description is a significant, separately identifiable evaluation and management service by the same physician on the same day of the procedure or other service, meaning that it's not simply saying that patient came in, patient is being treated with TMS, add a 25 modifier, and the payer will simply pay. The payer is looking for, if this patient is being seen twice by the same physician on the same day, those two services should not be related. That's the definition of the 25 modifier. So we want to make sure our documentation supports the fact that that E&M visit is totally unrelated to the TMS visit on the same day by the same physician. The next question, can a patient only have TMS, or is the patient only eligible for TMS once per year? The answer to that question is no. Patient has the ability to be reintroduced to TMS or be retreated with TMS based on some specific criteria that has been laid out by individual payers. That information looks like, if the payer has been previously treated with TMS and the patient was able to receive a 50% reduction by measurements of rating scales and documentation, then the patient is eligible to be retreated or reintroduced to TMS. That's where documentation is essential to make sure that we are tracking patients post and pre-treatment to understand where that patient began in this therapy treatment and where they ended. So when that patient or life happens for that specific patient. We have the documentation to show that the patient did receive a 50% reduction based on that patient's specific insurance plan, and based on their coverage criteria. We want to show that we have that document, and we will submit that to the insurance carrier. And based on their coverage policy, we feel that they will give you an additional treatment course, not maintenance or boosters, but an additional 36-session treatment course. The last but not least, can a patient have multiple treatments on the same day? The answer to the question is no. There isn't any bandwidth or any documentation that we have seen from any specific payer that allows for a patient to have multiple treatments. Insurance policies state that the treatment is meant to be 5 days a week for 6 weeks. Multiple treatments on the same day will lead to a denial, and there's no protocol for treatments on the same day, regardless of need. So if we have a patient who says that she or he is going out of town and they don't want to miss a session, so they want to double up on a session, that's not going to be payable for the insurance company. Ultimately, it will lead to a denial. Keys for success. You want to make sure that as a provider, you perform your benefit investigations. You want to use your NeuroStar reimbursement managers and your NeuroStar reimbursement support team to assist you in that process. We want to make sure that you obtain authorizations. We want you to partner with us along the way. So if there's a denial, if there is any information that's being requested and you're not clear about what your next step should be, call on your reimbursement manager and we will walk through you with that process. Make sure that you have your prioritizations on all your claim forms. Access to your NeuroStar team will allow you to get more patient access in the NeuroStar and get your questions addressed. We don't want you guys to not reach out to your NeuroStar reimbursement manager, which ultimately can delay patients getting into the NeuroStar, which ultimately means that, that patient either will determine later on down the road that they no longer want TMS or they decided to go somewhere else. And we want you as NeuroStar providers to treat those patients. So take advantage of the reimbursement managers and make sure that you communicate with them often and regularly, or make sure that your staff is communicating often and regularly. We want you to proactively address challenges and changes. Let's not allow any significant amount of time to pass. Get your reimbursement managers involved. That's what we're here to do, to partner with you guys. So proactively address challenges and changes. Last but not least, we just want to thank you for spending time with us today to review some general topics regarding reimbursement. Any of the reimbursement managers will be able to walk you directly through any of the processes or tools that we've demonstrated today. So again, we want to thank you for your time, but please do not hesitate to contact your reimbursement manager to integrate them into your practice where reimbursement issues, questions, or claim denials, authorization are concerned. We are partnering with you guys throughout the life of your NeuroStar, and we want to see you guys be successful. Again, I want to thank you for your time.